right. Thank you, Claire Grace. Hello, everyone. Thank you so much for spending some time with us today. As Claire Grace mentioned, we are the Collaborative for Advancing Health Equity and Out of School Time. We will also just be going by the Collaborative, just because that's a mouthful. And thank you so much for joining us for our virtual institute session today, which is Healthy Eating and Physical Activity, Standards and Out of School Time. And this is our Training 101. So thank you so much for taking the time to be here with us today. As the Collaborative, we are in partnership with the Education Development Center and the National After-School Association, and we couldn't do this work without the support from the Centers for Disease Control and Prevention, commonly known as CDC. Together as a collaborative, we are working to ensure that all youth have a fair and just opportunity to be as healthy as possible. So, in moving forward, I wanted us just to take some time just to set the foundation. That's something that's incredibly important to ensure that we are all using the same language throughout this session. And so I want us to start off by talking about health equity, defining it. As we can see on the screen, it is a means that everyone has a fair and just opportunity to be as healthy as possible. And as we see on the image here, talking about equity, we wanting to make sure that everyone has the opportunity to cross the street, to make it to the other side, as one way of looking at it, whether it be through supporting someone who has a visible limitation or an invisible limitation, making sure that we are able to provide supports to ensure that everyone has a fair opportunity for health and well-being. So in moving forward, I want us to take some time to introduce Heidi from the National After-School Association to talk a little bit more about what NAA does, how we work together, and some really great opportunities coming up from NAA. Heidi?
Thanks, Bianca. Always a pleasure to see you. My name is Heidi Ham. I'm the Chief Operating Officer of the National After-School Association. Not only is it great to see you, Bianca, but Claire Grace and the whole team at the Collaborative, and then so many people whose names look familiar to me in the chat box. So this is great. Love seeing this. So the National After-School Association is the professional membership association for people who work both with and for youth during out-of-school time. We currently have a membership community of around 30,000 individuals, and we have 33 state affiliates. I see some of them also represented in the chat, so shout out to you. We work together to create a strong and valued OST profession that benefits kids, families, and communities. So you'll see that our mission there is probably shared by many of you as well. And one role that NAA plays is in creating, curating, and communicating opportunities. We work on connections and sharing resources. So in addition to the NAA HEPA standards, the Healthy Eating and Physical Activity Standards 2.0, which is the focus of today's session and the reason that you're here, I want to quickly highlight two other resources and opportunities related to the goals of the collaborative. And first, we have the OST job quality standards, and I think, yep, somebody has those ready and they're in the chat box now. So these are new. We have the job quality standards for OST. We have a usage guide and self-assessment tools. Those were released in June. They're a comprehensive framework that helps define and promote good jobs in the OST sectors. You'll see when you look at them that the standards are grounded in research and evidence and best practices. They also offer actionable guidelines to enhance job quality. And I know people love to hear the actionable piece because that's how we are in this field, right? So actionable guidelines to enhance job quality, to promote workforce development and address the recruitment and retention issues and challenges that our field has been experiencing for some time, and then more prominently after the pandemic. Not surprisingly, most of information in the standards contributes to staff well-being, which we know is imperative if we expect staff to support young people's well-being. The job quality standards, really, we're expecting them to serve as a roadmap for creating equitable, inclusive, and fulfilling work environments for OST professionals. And by promoting job quality, we are working to create a more stable and effective OST workforce. So that improves program access, that improves program quality and outcomes for young people. The other opportunity, and one of our signature things that we offer at NAA, is the NAA convention. We hope that you will join us next March, where we'll work to, and this is based on the theme, recognize people, encourage potential, and unlock possibilities. There'll be sessions related to well-being for young people and also for the adults who work with them. Meetup for folks interested in health equity. So you'll have a chance to meet folks on this call, whether from the collaborative or people who've entered and are participating in the chat. Let's see what else. And really a chance to celebrate and appreciate the unique strengths of individuals, and then also the strength as we all come together, which we know can really, really result in transformative change. So hope to see some of you there. That's all I got today.
Thank you so much, Heidi. Really looking forward to seeing you in Nashville. And again, for more information on the NAA conference, please feel free to utilize the links that have been provided in the chat. So now moving forward, let's take some time to talk about our agenda for today. Of course, we always want to do our welcome and our introductions as we have already done, but we're also going to make sure we take some time to go over some health issues impacting youth today, evidence-based strategies that have shown impact within the work of OST. We'll talk about HEPA, sharing from the field with our guest speaker today, some next steps and feedback survey and closing. And I just want to remind folks that, again, our objectives for today is to ensure that the role of healthy eating and physical activity in increasing the whole child health and wellness, that remains a priority. And so we want to make sure that folks are able to either roll away from their computer in their rolling chair or walk away with having some skills and some resources to elevate HEPA within their work. Now, before we move forward with our session, I would really like for everyone just to take a moment and just take a breath. Take a big breath in through your nose and out through your mouth. Maybe do it one more time. Breathe in through your nose. Exhale. Shake your shoulders. Wiggle your toes. Unclench your jaw and breathe. And the reason why I'm asking you to do this is because I want us to transport ourselves mentally back to 2022. And think about yourself and the work that we were doing at that time. A lot was happening, and it shows through the data that we see in YRBS. With next slide, please. YRBS, or the Youth Risk Behavior Survey, as many of you all may know, is a national survey that is taken every other year, and it's an opportunity for young people to share their experiences related to their overall health and well-being. There are questions that are on this survey that relate to nutrition, housing, violence, sexual activity, physical activity, mental health, and etc. And so when the YRBS for 2023 came out, it was an opportunity for us to really think about and see what are the children experiencing at that moment in time, in 22 to 23. And the data shows us that, first and foremost, that our young people have a lot going on. More than half of our young people from the survey who identified as high school students felt close to people at school. Female and LGBTQ plus students were less likely than their peers to feel close to people at school. We see that about almost 1/3 of students reported that they had ever experienced racism in school. And we see that Asian students were more likely than other students to experience racism in school. These are staggering numbers, but they are also a reflection of what is taking place today with our young people. And although that was in 2022, it's important for us to think about what is happening today as well. Because throughout, from since 2022 to current days, we've learned a lot. We've learned a lot about ourselves. We've learned about our priorities, our young people, and the communities that we serve. So I want us to take some time to talk about not only what was impacting our young people in 22 and 23, but also let's talk about what's impacting them today as well. We see mental health is a concern that has been a topic of conversation, quite honestly, for quite some time. For a lot of us who have been in the world of public health, these conversations are not new, but for some of us, they are, and they can be challenging. So it's really important that we are mindful that mental health crisis are issues that are happening with our young people today, and resources are available in communicating with young people about those concerns. We also see food insecurity and housing instability has significantly increased for our young people. Living environments that impact health, whether it's because there's a lack of access to transportation or there's a lack of resources within the community. These are things that can impact a young person's health. Lack of access to healthcare, and then also being mindful that racism is a threat to health, and that is something that we have seen over time. And so these health issues that we see here on the screen today, these are, the big ticket items that we see that researchers and scientists are telling us about. But we want to hear from you. We want to hear from the folks who are representing their state or their communities, who really have that, on the ground experience. We would love to hear from you what other issues are impacting youth in your community. Now, before you get excited and tell us in the chat, we want to do a waterfall activity or chatterfall activity, excuse me. This is when folks are putting their responses in the chat, and at a certain time, we will all press enter together, and we will see a collection of thoughts and issues that are impacting youth in your community. So I'm going to give folks about 10 seconds just to type. Do not press enter, just to type in the chat. What are some other issues impacting youth? And I will let you know when we will have a countdown to press enter. So we'll give you 10 seconds just to type. 7, 6, 5, 4. All right. Now, when I say 1, we are going to press enter. 3, 2, 1. Press enter. Peer pressure, childcare, social media. All right, keep them coming. I'm seeing a lot of social media, a lot of peer pressure. Keep them coming. Keep them coming. What else do we see? Staffing, that's a big one. Access to reliable and free transportation, food deserts, food adultism, staff visit, substance abuse. That's a big one. That's a big one. Thank you so much for sharing. Unsupportive parents. Yes. Professional development opportunities. Yes. All of these things can impact a young person's health and well-being. And so with that in mind, thank you for sharing. We want to be mindful that although these young people are experiencing a lot of the challenges that we see here, not only on the screen and in the chat, we do know that out-of-school time providers, high quality out-of-school time programming has a positive impact. It may not fix everything, but we are surely there to support our young people with some of the things that are really important and that really matter. The good news is that OST has an impact. There are several studies that show some of the positive outcomes for students from OST, including but not limited to engagement in school, improved school day attendance, fewer disciplinary referrals, improved social skills, and reduced behavior problems. These are all incredible, and this is all because of all the great work that folks in OST do, which is you. In addition to all of the great work that you do, it's really important that we are mindful about how this all works. When we talk about high quality out of school time, we're talking about programming that supports the whole child health and wellness. Next slide, please. When talking about the whole child health and wellness, we're focusing on policies, programs, and practices that have a significantly positive impact on increasing access for youth, including those who are experiencing worse health because of their environment, whether it's lack of resources, exposure to racism, or other factors related to where they go to school, where they play, where they live. So we just want to be mindful that when talking about out of school time programming, we want to make sure that that high quality programming is addressing the whole child health and wellness. So including healthy foods and physical activities, safe spaces for young people to engage in culturally relevant learning, where they are able to be challenged and have opportunities to learn and interact with other young people and supportive adults and engage in those positive, healthy relationships. So in talking about all of the great benefits of OST, which I'm sure you all are very, very mindful of, we are very interested again in hearing more from you. What are youth health and wellness, I'm sorry, how are the youth health and wellness supported in your OST program and community? How are the health and well-being, it's a mouthful question, but how are we looking at youth health and well-being, and how are they being supported within your OST program? So we are going to do the Chatterfall. Again, really take some time to think about how are the youth being supported within your community. I'll give folks 10 seconds. 10, 9, 8, 7, 6, 5, 4. When I get to 1, we'll press enter. 3, 2, 1. All right, let's press enter. Oh, here we go. Here we go. I love to see it. I love to see it. And you still have time if you need to. Oh my goodness. I love seeing this. What do we see here so far? How are the youth health and well-being being supported? We see this through trauma-informed practices, continuous improvement. We see opportunities for active play. I would love to hear more about that. I would love to hear more about clear communications within systems, because I think that's incredibly important. We talk about everything bothering them and invite professionals to talk about general mental health. I love that. I would love to hear more about that. We have social workers come in, yoga, walks, nutritions, all of these amazing activities are fantastic. And I really wish I had something like that when I was growing up. But I'm loving that there are really unique ways that folks are elevating the health and well-being of their young people, whether it's through collaborative partnership, utilizing the resources that are already on hand, or taking measures into your own hands and utilizing curriculums and resources like the collaborative to really brainstorm and find opportunities to increase physical activity and healthy eating. So let's talk about some evidence-based strategies. How can we continue to do this? Now, these are strategies that I'm quite sure folks are already doing, but if some of these are new to you, or you would like to dive deeper into these strategies, the collaborative is here to help you with that. But some of the evidence-based strategies that we have seen that have been helpful in elevating the health and well-being of our young people include adopting policies to make nutritious food and physical activity more routinely available, partnering with community organizations, which we saw in the Chatterfall as well, strengthening these relationships between staff and school nutritional professionals and increasing access to food storage and support. And we also see the implementation of the National After-School Association's NAA Healthy Eating and Physical Activity Standards. Now, these standards are also known as the HEPA standards, and they are a really great opportunity to not only learn about the importance of physical activity and healthy eating, but these standards also go into the what, the how, and the why. And with that being said, I'm going to turn it over to Claire Grace, who's going to share with us a little bit more about the HEPA standards and introduce our featured speaker for today. Claire Grace?
Awesome. Yeah, thanks, Bianca. So we would love to start out by first finding out how familiar are you with the HEPA standards already? And so I'm going to invite you to go ahead and annotate right on the slide if you're not familiar with how to do that. There should be a little kind of pencil looking icon that says annotate, or sometimes you might have to click the three dots where it says more, and you're going to click annotate. That's going to bring up a black kind of toolbar down one side of your screen. And if you click on this little check mark button, it's going to give you a whole option of stamps. And so I'm going to choose the star stamp, and I'm going to say that I'm aware of them, but I haven't taken any action yet. So go ahead and grab a stamp, put yourself somewhere along this continuum from I've never heard of them before today, I'm aware of them, but I haven't taken any action yet. I've taken some initial steps to implement. I'm consistently implementing multiple standards, or I'm an expert. And if you are on a device or unable to participate in any way, please feel free to post your response in the chat. Great. So this is so wonderful. We're going to give a minute for people to keep them coming or to add in the chat. Awesome. It looks like we're kind of right at the sweet spot today, that we have people this is going to be brand new for. We have some folks that have some experience doing it, and we'll be able to share, what was really successful, what maybe made implementing the standards a little bit challenging. Awesome. Awesome. All right. I see a few still comments. Let me give one more minute. Great. Okay. I'm going to ask that everybody stop annotating. I'm going to clear these, but you're going to have a chance to annotate again. Whoops, in just a minute. Okay, I'm going to, whoops, let me do it this way. We'll just turn that off for just a second. Whoop. All right.
And Claire Grace, just
Yes, ma'am.
so that you know, we have a lot of people in the chat who are also saying they have never heard of HEPA until today.
Great. Thank you so much for elevating that from the chat. I appreciate it, Bianca. Great. So you're in the right place, because this is what we're going to talk about today. So I want to introduce you to the National After-School Association's Healthy Eating and Physical Activity Standards for out of school time. Studies show that active children learn better, perform better academically, experience fewer behavior problems. We know this is one of the evidence-based strategies that you can be using in out of school time. And we know that not all children are getting the nutritious food and the physical activity that they need every day. And so the HEPA standards are one way to make it easier for you to see what already has this great evidence and research behind it, and basically kind of get started pulling from this menu. And there are a lot of them, right? Like, we're looking at the screen here and it's like, oh gosh, 19 in content and quality, and 5 in staff training, and 11 in social support, and 8 in program support. These are meant, to be aspirational. These are, we know that not everybody is going to be able to do all of these at once. We want you to be able to just get more familiar with them, to start thinking about which ones might be the easiest for your program to achieve. We might call those kind of low-hanging fruit, that like, oh, this feels like something that I'd be able to maybe get started right away and wrap into our schedule or add very easily into a policy. And then maybe there's going to be some that are going to just take a little more time to wrap your head around, think about who you need to have around you. We're going to spend a little bit of time talking about that today. So the HEPA standards themselves, are broken. Oh, sorry, excuse me. So I also just wanted to make note that they are broken up into these areas. And so the first content area includes standards that translate nutrition and physical activity science into actions that out-of-school programs can take to offer health promoting foods and beverages and physical activity. The remaining content areas have standards that address program and organizational policy, infrastructure, and kind of reflect implementation, as well as just, again, sort of taking this health science and translating it into a way that lets you, really kind of look at and grab onto the things that you want to work on. And we acknowledge that not all standards are applicable to all after-school programs. These are really a guidepost for you. You might hit some roadblocks in implementing the standards. Maybe right now you don't have quite the right resources or exactly the right partners at the table. There might be some features that in your, particular staff position you don't have as much control over. But we want this to be a place for you to start, a place for you to think about, how could we do this? What partners might we need to bring in? What might I want to bring to my leadership or explore with my staff? And so today's just really an opportunity to get you familiar with the standards, encourage you to actually go to the standards and read through them and take a look at them, as well as taking an opportunity to use the HEPA self-assessment tool. And so they've also put together this great tool that you can use to, again, just take a look and see what are we already doing, what professional development, what program practices do we have available in each of these content areas. We can look for where we're doing a really great job and celebrate that. And then we can create a plan for where we want to, have a little bit of a stretch and we want to be able to implement some additional standards. And it can be used by administrators and supervisors to guide your program evaluation. You can use this as an opportunity to say, we're doing great with this. We're kind of there with this. We're not quite there with this. And again, use that to create an action plan to inform your process. And I just want you to think, to be reminded that the standards really just provide a shared framework that we can all be working from together. They don't change program quality or the knowledge of the skills of the staff and programs. The standards and the self-assessment tool provide a research-based. So we know these have been tested. These have been shown to be effective. It provides this research-based framework for after-school professionals and leaders and other partners to just be able to understand and to measure a program's healthy eating and physical activity and plan for improvement. That's what we're always working toward, right? Quality programs that are focused on quality improvement. We're doing great at this. Where can we do better? And I know that lots of you on the call today are probably already doing a lot of these things. And so, here are some examples of things that you might be implementing: encouraging youth to eat more fruits and vegetables and participating in physical activity. Maybe you've looked at your program practices and you said, oh, we're going to make a change. And instead of offering juice or water, we're just going to offer water. We're going to make sure that there's water available to every student every day, or we're going to provide something for them to refill, or we're going to ask them to bring water bottles from home every day. It might be something you do a little bit more informally, like creating an informal written plan of action for a program. So this might look like just updating the written schedule that's on the wall, that we want to make sure that everyone is getting outside for some physical activity every day. And so we're going to look at the schedule and we're going to build that in every day to our schedule. It might be more formal. Maybe you're going to actually create a more formal policy that you want to make sure that all staff that are working in your program have had so many hours of professional development and healthy eating and physical activity, or that all staff are going to come together once a year to look at these policies together and create an action plan that will be revisited periodically. And so, there can be, we kind of call it like big P and little p policy and practices. And so there's things that you can start doing and then things that you can work toward having more formalized in a written policy. And then health communication. one of the pieces of the standards, and one of the ones that we're going to get a chance to do a little activity with, is really about how are you engaging families and staff and members of the community in this? How are you sharing this information about how important it is to get some physical activity, to some tips around healthy eating? And so really thinking about what are you doing already? Or, is this something you're already doing? You're maybe putting something in your newsletter, or you're sharing with parents when they come for pickup to say, hey, we tried 3 different kinds of apples today for part of our fall activity. And Michael really loved the yellow one, and ask him about that activity that we did, and how we talked about, where apples come from. And so I'm going to switch the annotation back on. And I would love if, once again, you just click that little pencil that gives you a space for annotation. And it'll bring up your annotation toolbar. And then just go ahead and put a stamp. I'll give you an example. Just grab a stamp, and you might say, oh, our program's already doing this, and we definitely do this. It doesn't matter sort of where on the screen it is, but we'd love to know what you feel like your program is already doing well. Great. I see some coming in under child behaviors, program practices, some informal policies, formal policies. Great. Health communication. Awesome. All right. Lots of hearts and stars. This is exciting. This is so great. And please feel free to share in the chat if there's something specific that you do that you feel like, great. I do see someone say they follow the state guidelines for healthy snacks. Other folks are sharing the ones that they're already doing. If you've got specific examples, please feel free to share. This is a great place to get some ideas from your peers. And so if there's an informal policy that you are implementing that you would love to share a little bit about, please feel free to share that with us in the chat. Awesome. Informal policies for physical activities, group gym games, and outdoor activities. Great. This is awesome. Providing positive signage. Ooh, then Kat, I'd love if you would give us an example. What kind of positive signage are you using in your facility? And anybody else want to share anything in the chat that they want to celebrate that they're already doing well? I'm not a direct provider in out of school time currently, but I, while we're waiting for something in the chat, I figured out just at home with my own little guy that if I served him his fruit or his vegetable before I put the rest of the meal in front of him, he actually eats his whole fruit or vegetable because he's really hungry. So he just sort of eats that while he's waiting for something else to come. So I feel like that is my little encouragement of encouraging youth to eat more fruits and vegetables. Oh, yes. Thank you, Jimmy. Working with staff not to eat unhealthy foods in front of students. I appreciate that. Let's see. We got a couple more coming in. Modeling healthy activities and eating healthy in front of the youth. So we've got a couple of those that's staff development, right? Talking with staff about why it's important to model, why you want to be thinking about what you're doing in front of youth. We have a community steering committee and meetings regarding youth, family, and community needs, so we can find partners based on the health and wellness expressed. I love it. Constantly narrating healthy habits and praising when children are executing healthy behaviors. Awesome. All right. Well, thank you so much to all of you for being willing to share. I'm going to go ahead and clear this. And keep it coming. If you think of something, I'm sometimes one of those folks that 5 minutes later, after it's sort of circled around in my head, is when I think, oh, I now I have a thought. So that's the beauty of the chat. Feel free to keep adding things as we're rolling along here. And in the meantime, we really wanted you to have an opportunity to hear an example of what this looks like in the field. And so we have invited Jane Harrington, who is from SNAP Ed at Zufall Health, to come and talk with us a little bit about today about how she is doing this. So Jane, I am going to hand it over to you.
Hi, everyone. Thank you, Claire Grace. It is an honor to be here today to share a little bit of our experience with OST. As Grace gave me the introduction, my name is Jane Harrington Selitto. I'm a registered dietitian nutritionist, and I have a background in working with the pediatric population, both nutrition counseling, leading programs for increasing physical activity and focusing on healthy eating. Currently, I am the director of SNAP Ed at Zufall Health in New Jersey, which is a federally qualified health center, and we are a subgrantee for an implementing agency of SNAP Ed in the state, covering 5 counties. And then what I would like to do is just put out a poll to start off with to see how familiar everybody on the webinar is with SNAP-Ed. If you are currently working with a SNAP-Ed team or not, or maybe you're a SNAP-Ed provider, if you can take a few minutes just to answer the poll, that would be great. We'll leave it up. I see there's definitely some replies coming in, so thank you, everybody. A couple more seconds. If you haven't already answered. Still see some votes coming in. Maybe we'll give it like 10 more seconds. Don't take up too much of the time, but just wanted to gauge a little bit of how much to go into SNAP-Ed, how much everybody knew about it. Even if you're not already working with your SNAP-Ed team, you might still have a familiarity with the program. Okay, great. I think we can end and share out the results of the poll. And it looks like not a lot of people have been working with their SNAP-Ed team yet, which hopefully I can share some information and we can get that going a little bit more. And like, even if you're not already working with your SNAP-Ed team, we can connect you with some resources to be able to. And then what SNAP-Ed is it's the Supplemental Nutrition Assistance Program. It's an extension of it that really focuses on the nutrition education side. And we look at aiming to provide nutrition education to help low-income New Jersey residents make healthy food choices within their limited budget. Now, we're in New Jersey, but it's in all states, and you can look and see in your county who might be your local SNAP-Ed provider. We shared a link in the chat that you can look up a little bit more information about SNAP-Ed and find who the provider is in your area to see if it would be an option to connect. And what we do is there's a few different arms of SNAP-Ed. There's our direct education, which is more of what you would think of with a nutrition class, where we have people register. There's nutrition presentation, very interactive though, so we'll take questions, and then we have a food demo and sometimes we have the participants take part in helping to prepare the food. And then we also have our indirect activities, and this is more tabling style event. Maybe we're just giving out handouts on nutrition education. We have our marketing, social media, where we have a Grow Garden State program, and that's really encouraging New Jersey residents to grow their own fruits and vegetables. And then there's our policy systems and environmental change. And this is where we could work with healthy, on our Healthy Pantry initiative, work with pantries to try to help them offer more fruits and vegetables and whole grains, or we could work with schools or after school programs, and that's where OST would fall into our SNAP-Ed work. And really what we do is start to connect with it could be through coalitions, it could just be through partnerships, and starting to see where we might be able to help in our communities. And that way we can look at what sites might be appropriate, start looking at planning, and really just sometimes it can take a little while for us to build those partnerships and really get started, but the more we can get out into the community and show what we're able to do then, and what we're able to offer, some of the funding that we have to help support, And what we will first do is see what areas might work out well for us. At Zufall, we have OST at a couple different types of sites. We have our schools that have after school programs, and then we work with some youth centers as well. And once we're out making connections, talking with everybody, looking at what sites might be the most beneficial and helpful for the community, that's when we will start to see if there's an interest within the site to form a wellness committee. Now, the wellness committee does not have to be huge, but just a few people who are interested in helping to make it happen, and will go through the assessment tool with us and see where we can start to strengthen, because we do want to make sure that we can address some of the barriers or some of the challenges and things that we can improve, but also, as Claire Grace had said, make sure that we can enhance anything that's already going really well within the community. So it's really just, as far as the assessment, the planning, it's trying to keep forming that relationship with everybody out in the community and making sure that they know the resources that we have, which I will start to get into. And then I think if we go back one more slide, perfect. So on the really starting to plan on what kind of challenges we can address and how we can improve what's offered to the community through OST. So if it's increasing access to healthy foods while at the program, and it might be looking at different grant opportunities, might be connecting with some of the pantries and food banks that we have partnerships with. Through SNAP-Ed, we also have a Veggie Van initiative that works on trying to get more produce to communities and make it reduce the barrier of trying to travel to get to the food, because the area that we're in is very rural, so transportation can often be a barrier for us. And one thing that we will do is bring the fresh produce right to the after school program, whether it's in produce bags or just set up and families can take it, and then it's fresh produce for while they're at the program, but they can also take it home with them as well, which is a really nice option. One barrier that we do want to look at is just the weight of the bag of produce, especially if they're older kids and they're walking home, to make sure that we are just conscious of that. And then looking at ways to strengthen physical activity, and the availability. So making sure, as we're going in and educating on healthy eating and increasing physical activity, that the tools and the resources are there. Can we donate hula hoops? Can we donate kickballs? What kind of things can we use our funding to provide for the site? And then also looking at, we have a community garden PSC, and that often goes very hand in hand with our out of school time work, where we will help to build a garden and help to get soil, some seeds, and get that going. Or it might be more of a sensory garden that's available at the school. And it's just trying to get a group together and see how we can, if we start with a garden, how we can build that and make that into something even more. And then that's what we can do through utilizing some of our partnerships and really starting to use work that we're doing in hunger, health coalitions, and if we can bring in resources for some things that we're already doing. Like if we're already doing the garden, can we bring in the cooperative extension program, bring in master gardeners to plan any, like, the best placement for the garden in the area, any great what produce we should plant if there's something that's going to really thrive in the area, or bringing in like the Watershed Alliance to look at how we can collect rainwater, have a rain garden, and really trying to look at the whole system. So while that's not nutrition education, we do try to, within all the different partnerships and being out in the community, see who we can connect to, see how we can enhance some of the programming. And then it might be going back up the food, working with food pantries and food banks to increase that food access. Because since we're already working at the food pantries for education as well, or for a healthy pantry initiative, we might be able to connect them with an after school program to have some of those foods available. And then through SNAP Ed, we are able to layer in our direct education. So our nutrition education classes with our out of school time initiative. And we will focus those classes. All of our classes focus on eating more fruits and vegetables, whole grains, reducing sugary beverages, increasing physical activity, maintaining nutrition balance at all stages of life, and then shopping healthy on a budget is also part of some of our curriculums. Within SNAP Ed, all of our curriculums are approved at the federal level. So really what's implemented and what we go through stays very consistent. So we have two main ones that we will implement in combination with OST, and that's Cooking Matters for Kids and Teens. And then we have our Food Smarts, which is approved also for adults, but we use the kids version, and that will be really has a basis on trauma-informed care. So it's one that we are bringing into some of our youth centers, and it will offer a variety. So sometimes we'll even do both of the curriculums at each class. So we'll go through Cooking Matters, and then we'll do Food Smarts, and sometimes we'll bring in different kids. Sometimes the students or the children and teens, they'll love it and they'll want to keep going to the classes. One of our youth centers that I do want to share about, we are there for after school programs, some of the drop-in teen sessions, the summer program, summer playground program, and we reach over 200 students, and really the children are so engaged, really love to learn about how to fuel and different ways to move their body. And this is one that we were able to provide hula hoops, kickballs for. We were also able to provide bike helmets for this group. They were having a bike event, and to expand the reach and to promote safety, we were able to donate the bike helmets to go along with it. And this is just really a nice way to show it doesn't have to be a competitive sport. There's other ways to engage in physical activity. And then we're not just promoting and saying like, let's do this. It's providing some of those tools to switch it up as well and provide different opportunities. And it's one of the things that we really love as part of SNAP Ed is being able to layer our direct education, and OST just allows us to enhance it and be able to offer more to the community that we're working with. And it's been great, great to work with and a great complement to the direct education. Thank you for having me on here. And if there's any questions that come up, please feel free to put them in the chat. We will have some time for questions following this, but my contact information is on there. So if you think of something later, feel free to send me an email. I am happy to connect and provide any information.
Awesome. Oh my gosh. Thank you, Jane, so much. We're going to have folks post questions in the chat, or if somebody wants to raise their hand, if they'd like to be, if they'd like to unmute and come on and ask a question. I'd love to start it off just that I want to be sure that I'm understanding correctly. So when you said, you know, you have classes that you offer, you've talked about helping secure hula hoops and, you know, gym balls and things like that. So is that something that like anybody that's on today can find the SNAP Ed person in their state and make a connection to maybe be able to leverage some of these in their out of school time program as well?
Yes, so I would definitely recommend reaching out to your SNAP Ed provider. Each one, so we write out a plan of which ones we want to implement, but majority, and I believe out of school time is one that most of the providers should have in their wheelhouse, and then be able to provide those resources. They might have certain suggestions, certain ideas, but it is something that across the board as SNAP Ed we're able to participate in and assist.
Great. And if we haven't already, we're going to post the link in the chat for folks where they can actually go on the sort of wider SNAP Ed website to read a little bit about it. And then there's a tool that you can use to find the contact in your state. So that'll be in the chat. Awesome. Thanks so much, Kate. And then Jimmy's just sharing, Jimmy St. John was just sharing that their after school program works with the University of Tennessee Extension Master Gardener program. So again, utilizing their extension. And I know that Kate put a link where folks could find their local cooperative extension. They do the From Seed to Plate activity, growing and caring for a garden, harvesting the crop, cooking food for students and family. Their middle school site conducts a cooking class that encourages choosing and cooking healthy food, and recently purchased a greenhouse. Thank you for sharing that example, and that is a SNAP Ed program. Yes, awesome. Thank you.
Thank you.
So what other questions do folks have, either for Jane, or if you've got a question for myself or Bianca about anything that we've shared so far? We'd love to hear your questions. I will say I can't quite see everybody at once. So I encourage, if you've got a question that you want to ask, just go ahead and unmute yourself and ask. Oh, it looks like maybe Bianca's come off mute.
Yeah, I just have a quick question. Jane, you mentioned conversations. I'm sorry, you mentioned access, transportation being a concern. Can you talk to us a little bit more about that? Because that seems to be a concern for a lot of folks, and it's not just a regional issue, it is a national issue.
Definitely. So what we try to do, since we are seeing that as a barrier, is anytime we have anytime we can make it easier. So if we can bring the food to the community, to a convenient spot, that's what we want to try to do. Just make it convenient for more of our participants within our classes, within our programming. So what we'll do is bring one of our programs is bringing produce bags to one of the youth centers that we work with, and then this children and teens will take it home with them after being there. So it's right then and there. It's not an extra step of another stop, and just trying to, as much as we can, make it as convenient as possible. And while there's definitely more that we can do in that realm, that's something we've seen works very nicely.
Thank you
Is there anyone
so
else that
much.
wants to? Yeah, please.
I was just gonna say thank you so much, Jane. And I see that Jimmy St. John was saying that that the program that they were talking about is a SNAP Ed program, and I'm assuming that is through the state of Tennessee, so University of Tennessee Extension Program. So yes, so it's good to see that SNAP Ed is actively working and engaging with our states, and we have some great examples.
Awesome. Well, Jane, thank you so much for sharing that with us. And Jane, I believe you're planning to stay on through the end of the webinar. And so Jane will still be here. If you think of anything else, please feel free to keep your questions coming in the chat, and we'll either answer them at the chat, or we'll get a chance to answer them at the end. And I am going to now bring my slides back up. All right, look at that. So now we're going to roll into an activity. We want to take some time to think about, starting to just think about, if I wanted to implement a standard, kind of where am I at already? What kind of resources might I need? Would I need training for my staff? Would I need, or for myself? Are there materials that I'd need to do this? Would I need space? Would I need refrigeration space? Would I need, whatever it might be? An opportunity to think about what resources you might need, and then an opportunity to think about what partners you could engage to build those needed resources. I thought it was interesting that Jane in her section talked about connecting with local food banks and local food pantries. I hadn't thought of that as a resource that maybe they're able to provide some produce, or, connecting with other local retailers or organizations, depending on what it is that you're looking for. Maybe it's something around family engagement, and it would be really happy if you had somebody who you could, make a partnership with that's really savvy at social media to share some of the things that you want to share out. So we want to give you a chance to do this. Today, we're going to use Mentimeter. Really easy to navigate. There's two ways that you're going to be able to get access to the questions that we're using. And there's going to be a series of 6 questions. We're going to do 2 standards, 3 questions each. We'll pace it for you. So we'll show a question. We'll give everybody a little time to answer it. I'll kind of reflect on what I'm seeing on the slide, and then we'll bring you to the next question, and it'll just walk you right through it. All you need to do is click on this, you can use this QR code, or you can click on the link that Kate is going to post in the chat. And I will just navigate briefly to show you the first standard that we're going to use, and then Kate will share her screen to let us all see the results in real time. But again, what you're going to want to do is use the QR code or use the link in the chat to actually navigate yourself to the web browser page for Mentimeter so that you're able to actually actively answer the questions. Let us know in the chat if you have any questions or any trouble navigating that. I just want to share. So the first standard we're going to look at together is from the HEPA standards. It's the Quality and Content Standard 2, which is to include a fruit or a vegetable at every snack or meal. Fruit and vegetables are fresh, frozen, or dried with no added sweeteners or canned in 100% juice or water. And I don't know. Oh, I see it. I'm sorry. I was waiting for the Menti link and realized it was there. I just hadn't scrolled down far enough. So I'm going to stop my share and I'm going to let Kate take over the sharing. Wonderful. Oh, look at great. This is awesome. We have folks answering already. So again, the standard we're going to look at first, offering activities that include a fruit or vegetable at every snack or meal. So find yourself along this continuum. We don't do this or we consistently do this. Right now, it kind of looks like we've got a majority of folks right here in the middle, although we seem to have a pretty good span across both ends. I'll give just a minute because it looks like we've got a few responses coming in still. Okay, great. So it looks like most folks kind of fall in between not doing this at all and doing it really consistently. Kate, I think we can go to the next slide. Great, thank you. So if you wanted to do this, if you said, we really want to be able to offer, a fruit or a vegetable at every meal, what kind of resources would you need to be able to do this? And this one is short answer. You could just type your answer. You can answer more than once if you want, and just hit submit, and then we'll see all the responses pop up here on the screen. So what kind of resources do you think that you would need to be able to offer a fruit or vegetable at every meal? Great. Different snack options, money, everything. Tell me more about everything. You need the money, more funding for fresh food purposes, training. Yep. Maybe somebody want to say a little bit more about what kind of training you think you would be needed. Better budgeting, different snack ideas. We've got in the chat, we'd need a refrigerator, we'd need money, space to hold fresh fruits and veggies.
Somebody
somebody's
also
saying,
put that they
please.
needed, if you scroll up, a
I'm sorry?
standard guideline.
Oh,
That's awesome. They're in the right space.
great. This is super helpful. So thinking about what resources you would need, let's go on to the next slide and think about what partners you could engage to build needed capacity. So you just thought about all these things you need. And obviously, what you really want to do is be sitting around at a table with some members of your staff, with some members of leadership, with some parents, with some members of the community, maybe with some youth themselves, to be looking at this and saying, what is it we want to do? What could we do better? Think about the resources you're going to need, and then think about what partners could we engage? Well, if we need some refrigerator space, is there someone whose building is really close by to us that would let us use some of their refrigerator space? So maybe there's another business that we could partner with. Is it that we would need to purchase a refrigerator? So maybe there's a service organization or local business that might offer that. Do we do programming with the schools? And maybe if we connect with someone in school administration, they would be able to give us permission to have access to some of their storage space. So what kind of partners could you engage? I see community organizations, local businesses, state agency representatives, a local farm, food pantry, local businesses, farmers markets, blue zones. Yep. I think it's always helpful when you're starting this kind of work to do some community mapping and really say, hey, who else in our community is supporting healthy eating or supporting physical activity? And that can lead you to partnerships like county extension, like folks that are working on blue zones and some other things. So So great suggestions. Sports organizations. I see again, community organizations, the principal. Awesome. Going to the school district, parents. Yep, absolutely. You know, if we're doing assessment of what we're doing and we're looking at where we want to go, we always want to be doing that with the people that are being impacted at the table, helping to look at that, helping to drive that, helping to plan for it and say, I don't know if this is going to go the way you think it's going to go, or saying like, yes, this I think is the way to do this, or this is a partner that we could bring on. So absolutely, we wanted to be including parents. What great. School district supervisor. Yep. I worked with a program that we were doing family programming, and we wanted to be able to provide a meal. And we ended up connecting with the dietitian at the local grocery store. And she was able to provide some healthy snacks for us, and also actually gave us coupons for everybody that was in the program for fresh produce. And so we were able to give those out to families to then, the kids got to try some different things and make some things during the program. And then the families were able to go and take those coupons and go and purchase some of the produce themselves. Great. Anything else in the chat that you might want to share around this standard of including fresh fruits and vegetables in every meal? Something maybe that you've been doing that's been really successful in helping you do that, and you want to share a little bit of a success story, or any idea about this standard that hasn't been shared already? I'll give just a minute to see if anybody wants to come off the chat or wants to share anything else. All right, well, we got one more. So Kate, if you want to advance it to the next one. So the next standard we'd love to walk through is to develop opportunities for families and community members to advise and support healthy eating and physical activity in the program and in the community. And so again, just find yourself along that continuum that you don't do this at all, consistently do it, or maybe somewhere in the middle. And it's still moving, so I'm going to give everybody just another minute here. All right, so again, it kind of looks like everybody falls a little bit in the middle, that you're maybe doing some of this, that you're, creating opportunities. We heard from someone earlier that talked about having a wellness council. So it sounds like maybe they have a more formalized way of doing this regularly. Maybe you're not quite there yet. And so that might be something that you want to think about, of how can we have more opportunities for parents to be advising us on healthy eating. Oh, no worries. If you weren't able to answer, please feel free to answer in the chat also. So whether this is a survey, this is something as informal as just asking parents at pickup, what their opinion is about things, or what they think about things, what they would like to see happening. Is there, a fruit or a vegetable or a food from, their culture that they would really like to see included and celebrated, that you could make part of a cooking lesson that you're doing, celebrating healthy eating? There's all kinds of ways to do this, from, things that are pretty low hanging fruit, to creating a more formalized survey, creating a wellness council, creating quarterly opportunities, making this, something you give folks a chance to talk to you about when you're already at an event, the parents are, already present and gathered in one area, and you have them as an audience. So it's great. It looks like we're kind of right in the middle here again. We can go to the next one. So what resources would you need to implement this standard? If this is something that we sometimes do it, but we're not consistently doing it, or even if you're consistently doing it and you'd like to kind of continue to improve, what kind of resources would you need to do this more regularly? So we've got training, and if you want to share in the chat or share in here, what kind of training? Is it, frontline staff training? So what kinds of things do you think staff would need to be trained in specifically, if you have any ideas. And I see orientation for parents, training materials, willingness from other entities to collaborate. Yep, building those partnerships to get information out and bring collaborators in. Training and community support, training resources, staff training, how to model this, okay? Time and funding to hold outside meeting with parents. Oh my gosh, thank you. I think that that's something sometimes in kind of thinking through, oh my gosh, this is such a great idea. We want to bring a whole bunch of parents and community members in because we truly want their input, taking the time, really thinking about what might be the barriers of participation to parents being able to come and give us their input and their time. And so we talked about transportation earlier, like, would we want to provide some sort of transportation, like vouchers for buses or covering ride shares or gas cards? Would we want to provide childcare at the same time? I mean, I have an 8-year-old who's gotten pretty good at being able to sort of sit, quietly next to me if I'm at a meeting, but for a long time, if I wanted to be able to actually listen to what was being heard and, share my input on something, it was really hard to do if my kid was like crawling around my feet, asking me for snacks every 2 minutes. And so, maybe you are able to provide some childcare. Maybe you're able to hold multiple options or hybrid options. So there's different ways for parents to join. But again, transportation, childcare, maybe providing a meal or some snacks, those things we, of course, all cost money. And so who are some of the folks that you can partner with to be able to do those things and to really get that engagement? So thank you for sharing that. And then what partners could you engage to build that needed capacity and resources? And so, I've already kind of read what you all have shared a few other thoughts. And so who would you want to bring in to be able to do that? So if you need funding for this, if you wanted to get transportation or childcare, if you want a way to be able to consistently communicate out with parents, great. Community leaders. What other partners would you want to engage in regularly seeking the input of parents and community members and communicating with them about these healthy behaviors? Great. Nutritionists, vendors, community leaders. What else? Ooh, oh, great. Health department. Yeah, that's the first time that's come up. All right. Health department, local businesses, county officials, vendors, experts. Tell us a little bit more about what kind of experts. Experts in what would be the most helpful in this case? More additional team members. Great. I'll give just a minute to see if anybody wants to add anything else. Okay, let's see, they keep moving around. Community action agencies, yeah, that was another one that we haven't mentioned previously, but most, I think all counties have a community action council or a community action agency that serves your area. And so being able to find out who that is, who runs that in your community and connect with them could be a really good connection. Awesome, thank you. Ooh, local tribal clinic. Thanks, Linda. Yeah, we didn't even talk about that specifically of, thinking about, again, the kids and the population that you're trying to reach and serve. How are you making sure that those voices are represented in your planning and in what you're doing? And so is it bringing in somebody from the local tribe? Is it bringing in someone from the local community who's really able to speak to what those barriers might be for parents and families and how to navigate them or how to best reach parents and families in your area? So thanks. I appreciate that, Linda. All right, well, we're going to stop the share of that, and I'm going to bring the slides back up. We do have just a few more things that we want to share with you. So let me pull these up. Don't go anywhere yet. So this was the second standard that we looked at. So let me just click ahead here. Then this was the second standard that we looked at. And now I'm going to hand it over to Bianca.
Right. Thank you so much. Thanks for holding on with us, everyone. And so at this time, we really just want to do like a check-in with folks, really see how folks are doing. Again, we really appreciate you spending your time with us. And so we really just want to hear from you. So at this time, we're going to do a quick check-in poll that should be popping on the screen in a moment. Really fantastic opportunity for us to hear from you and see how we can improve our programming and our resources and support. So the poll should be on your screen as of now. We'd love to hear your honest feedback, just to do a quick check-in with folks, see how folks are feeling, see if folks are uh, good. So still getting some feedback. Good. Just again, want to hear how you feel. Quick check-in. Love to get that feedback. You know, we want to practice what we preach with continuous quality improvement. And so this is one of our strategies of doing that, checking in with the folks that we work with and that we coordinate and support. So thank you so much for your feedback and your participation. And we will move forward in talking about our reflection and our commitment to action. Thank you. So at this time, really just want to take some time to think about what can we actually do now. We've heard some great strategies. We've heard some really great examples. We've had some time to brainstorm and think about what can we do? What do we need? So now we want to take some time to think about what are some low-hanging fruit? You know, what can we do now? And also really take some time to think about what will you do to work towards achieving this in your future? Achieving in the future, excuse me. And then lastly, we would like for folks to commit to an action. Share in the chat. What kind of support will you need to make this progress? So you have your reflection questions. Think about to yourself, what are some of the things that we can address now? What are some low-hanging fruit that we can do now? But then also share in the chat, what do you need to be successful with that? Love to hear. And again, this is where we really want you to think about what can you do moving forward. What supports will you need moving forward? Having students to do the buy-in of that concept. That's a really big one, right? If your students and your young people don't believe in it and they're not going for it, it's going to be an uphill battle. So this is where you want to connect with young folks to see what are they interested in? What are some of the foods that they like? What would they be interested in trying? Maybe have different foods, and talk about different ways to make different meals, meal preps, healthy, etc. Really great feedback in the chat. I see, make the push to start serving fruit for our kids. Since I am a new since I am a new director to the program I am in, I have to get the staff on hand to start implementing this. You know what? That is a really good segue to our next resource, which is our assessment to action guide and workshop series. And talking about what folks can utilize, this is a great resource, the assessment to action, especially when connecting with staff and figuring out how we can collaborate together. So this is our call out to action. So this is our call to action that folks can do as well. Our assessment to action and workshop series. This is a really highly engaging space where folks can have the opportunity to talk to other OST professionals, think big, and take actionable steps to achieve their goals. Our audience for this is you. We are looking for program leaders. We are looking for 21st century site coordinators, school district staff, and school staff working in OST. The dates are here on the screen as we can see. Feel free to scan the QR code to register or utilize the link that will be provided, that has been provided in the chat by Kate. Thank you so much. This series is a really great opportunity to, like I said, come together, connect with peers. Also, one of the great things about this workshop series is that each session will feature opportunities to interact with tools and resources that you can immediately use. Lastly, I also just want to talk about that we have another great resource coming from the Centers for Disease Control and Prevention, and the AAP in partnership with the Food Allergy Research and Education, also known as FARE, F-A-R-E. They are launching a Strengthening Food Allergy Management in Schools resource, setting microgrant opportunities. This is also an opportunities for some microgrants. So we heard a lot about funding, that is being an issue and a concern. So if funding is an issue and concern, would love for folks to learn more information about some of the microgrants that are being shared out and distributed. For more information, please select the link that is available in the chat. Additional resources to help put HEPA in action include our the OSNAP initiative, which we learned a lot about today. Again, this is an evidence-based initiative that helps OST programs improve their policies. There's also the UConn Collaboratory on School and Child Health, where they are providing some really great resources on physical activity and nutrition. And then also we have the Alliance for a Healthier Generation, Healthy Out of School Time Roadmaps. Super, super helpful, really great resource to utilize when you are exploring the implementation of standards and how to create a healthier out of school time environment for young people. So we heard you, and we hope that these resources are helpful for you. Again, for more information about all of the great work that is happening within OST and resources that are available, we want to encourage folks to sign up for our mailing list. Our mailing list, the collaborative mailing list, will provide you access to our newsletter, get early invitations to our events, opportunities to amplify and share your work, like we heard today. Also, you will be able to receive first insight on curated resources and learning opportunities from across the field. We also have an amazing website that contains fully archived trainings, training shorts, and resources. So again, to learn more about the microgrants and other resources and just all of the great things that the collaborative is doing, check us out, join our mailing list. Would love to see you in the future and have you be the first to know of all of our workings and resources. And with that being said, we want to thank you for your time. We want to give a humble gratitude and appreciation to our presenter, Jane, who is the director of the SNAP Ed program at the Zufall Health. And we appreciate all of you for being here. Thank you, Claire Grace. Thank you, Kate, and thank you, Anna, from the collaborative. With that being said, enjoy the rest of your day. Please feel free to reach out to us if you have any questions, comments, or concerns. We are your partner in OST, so the collaborative is ready to collaborate. Thank you so much for your time, and happy Lights On After School Week as well. You may have noticed the background. So happy Lights After School. Thank you for your time, and enjoy the rest of your day.